Thank you, everybody, for joining us today. We are here live in our Laguna Niguel location. If you haven't stopped by, it's beautiful. And so let's talk about it. This is our neurotoxin event. Thanks for coming. Hey, Mariana. And today's agenda, we're going to introduce ourselves, of course, about us at Revive. You're going to meet our medical board, along with we're going to talk about these three different toxins, which are Botox, Dysport, and Daxxify. You're going to be able to see a live demo as well as Q&A, which you got. Feel free to actually put your questions in the chat. We can go over them as I can throughout the webinar. Otherwise, we'll leave it to our demo and we'll be asking live questions. And then we do have some special offers, so tune in all the way to the end to see those. And this beautiful young woman next to me is Heather. I'm going to go ahead and let her introduce herself.
Thank you. Hi, everyone. My name's Heather. I'm one of the nurse practitioners here at Revive. I have been in aesthetics since 2020, so about 5 years now. And before then, I was working in the hospital, worked with plastic surgeons and within the medical field. I specialize in full facial assessments, dermal fillers, neuromodulators, of course, and bioregenerative treatments, as well as advanced laser treatments. So I'm really excited to talk with you guys today, share my knowledge on neuromodulators and talks about it.
Thanks for being here.
Of course.
And hi, everybody. That's me. I'm Julie Norton. I'm one of our VPs here at Revive. I've been in aesthetics for about 13 years now. I've done any and all services. So when people ask, what I've done, I'm like, I've done it all. I just try it all. And I've definitely tried all of our toxins. So I'm excited that we're going to educate all of you today. I started in the beauty industry as a licensed cosmetologist. So I tell everybody I have a hairstylist every day that does my hair. And then I'm an aesthetics expert as well, and I've been at Revive for next month will actually be 2 years. So excited to be here. And thanks for joining us. So a little bit about Revive Med Spa is we've been around since 2006. We are the #1 provider for Botox, Juvederm, Allergan products, Cool Sculpting, as well as #1 in California for our Morpheus 8. We actually have 8 locations. 5 in Southern California, 3 in our Northern California. And that beautiful picture that you see here is our East Lake location. So if you haven't had a chance to visit our East Lake location, it is gorgeous. It's beautiful. And it was actually featured in Forbes magazine.
And then I forgot to mention, I work at the Laguna Niguel location, which is coming up on 1 year now.
Yeah.
Even open. So.
And this is our medical board, Dr. Leif Rogers, and then Dr. Vishal Verma. He's been here since the beginning. He's our co-founder, as well as Megan Naud. And we are absolutely led by experts in aesthetics. All right, what everybody's here for, right? What is a neurotoxin treatment?
Yeah, neurotoxin is amazing. So it's one of the most popular non-invasive cosmetic treatments because minimal downtime, quick treatment, as well as very quick results that amazing before and afters, and you really see a good difference with them. Tox is used in order to reduce the appearance of our facial wrinkles. So whether we have more dynamic movement when we're making movements and seeing those lines, or static movement, so more deep set lines that we're seeing at rest. So it's going to help to smooth those out, leading to a more youthful appearance and a nice glow of the skin. Mm-hmm. And then, yeah, so how it works, you can see in the photo there, that's very fine needles that we use to administer our neuromodulators, which is just a medication. It goes into our muscle. So our muscles talk to our nerves, or our nerves talk to our muscles, telling them to contract. That's why we do have our movement. So with Botox, it stops that signal that's telling our muscle to contract. The signal is called acetylcholine. So it stops that release. Therefore, our muscle is not able to move and leading to, smooth skin, low movement that lasts for about 3 to 4 months. And once we start seeing that movement again, we have our patients come back in for another treatment. So, yeah.
Amazing. Oh, one thing too is for how it works, how long does it take typically for it to set in for you to see results?
Yeah, so after injection, and it does depend on the different neuromodulators that we provide, but typically anywhere from a day to 14 days is when we're seeing that. And then at that 14th day, you're going to notice that's your full result from the Botox or from the Daxxify or Dysport that we provide. And yeah.
Awesome. So I'm sure everyone's knowing in this chat, if you haven't already had some kind of tox, so you're wondering, is it for me? So what is considered a good candidate to do tox treatment?
Yeah, so we screen all of our patients here at Revive to ensure that, sorry, my voice, to ensure that we're able to treat you with the neuromodulator. So we want to ensure that your health is in good standing. We go through a series of questions, ensuring that we can clear you for treatment. So skin conditions we're looking out for, pregnant or breastfeeding, which now there's being studies where we're seeing that breastfeeding may be okay in the future. It's not yet FDA approved, but showing very
So many moms are like, yes.
yeah, showing no real adverse effects from that. And then of course, 18 years or older, we do start to notice more movement as we're losing our collagen. So that's even as early as around 21. So we even have some patients come in who want Botox for prevention. So preventative Botox, so that we never develop those dynamic or static lines. So we always definitely hype up preventative Botox. It's important. And then those who would like a more youthful appearance to help prevent wrinkles as well as to treat their already maybe static lines that they do have. So yeah.
Mm-hmm. I think I did my first tox treatment when I was 25. And it was what I noticed was at rest, I was starting to see where my makeup would build up. And that's when someone's like, okay, you need Botox. But I would have never thought, I thought I was too young. So you're right. Yeah. A lot of young patients. How old were you when you first got your tox?
I was so young. I think I was like, I was 21.
Okay.
And they gave me like 4 units or
Yep.
something.
Yeah. Baby
But
Botox. It's a thing. It's a thing. So yeah, if you're noticing lines at rest, like it's really not about age and to being too young. It's more about what you're seeing and being preventative, like Heather said. All right, treatable areas. I know tox can be put in a lot of different places, but tell us a little bit about most common areas of treatable areas.
Yeah, so you can see over in the little video there, it's going over some of the most common areas. So we have the 11 lines. That's where you're going to notice in between the brow, where you're starting to notice little etched in 2 lines, usually for most people. That's why they call it the 11s. We have the forehead, the bunny lines, which is when you scrunch your nose and you can see little lines there. Crow's feet is right around the eyes on either side. Lip flip is right above the lip. So that's going to help to basically relax the muscle that's curving our upper lip in. So it can make for a larger upper lip or a lifted upper lip. So a nice appearance there if you're not looking for filler at this time for the lip. Platysmal bands is on the neck. And these bands kind of hook onto our jawline here and can pull down a bit. So by injecting the platysmal bands, it does help to give a nice snatched jawline as well as jawline tox. We call it the Nefertiti lift. And underarms, so hyperhidrosis, and that's excessive sweating. So we can treat that as well to help with that condition.
Amazing. All right. Usually when people talk about tox, they typically refer to Botox, but they don't know that there's a lot of other reasons or a lot of other brands out there. And that's why we're here today. So Botox, tell us a little bit about Botox specifically.
Yeah. So yeah, you're right. I feel like when you talk about a neurotoxin treatment, everyone thinks of Botox because it's been around the longest. But we have a lot of great neuromodulator treatments here. We offer Botox, Daxxify, and Dysport. So all are great. It really depends on the assessment, and everyone reacts differently to the medication. Some like Botox more, some may like Daxxify more. So it just depends on the clinical assessment as well as patient preference. I've used all of them and love all of them. They're all great. But Botox has been around the longest. It was approved in 2002. It actually was first used for more so medical conditions. So any sort of like neurological, for interstitial cystitis. People have used it for like TMJ into the mandible area. So it was used for that first and now is within the cosmetic space. So it's a really great treatment. Works for 3 to 4 months, as I stated before. And yeah, I love Botox for all of its
Me too.
uses.
Amen. And Dysport's another tox. Tell us a little bit about Dysport.
Yeah, so Dysport was the second neuromodulator to come onto the market about 10 years or so after Botox. So it does have a little bit of a larger spread or higher diffusion than some of our other neuromodulators. So that means that if you notice maybe when we're doing assessment, you have more dynamic lines, we'd possibly suggest Dysport to try because of that spread. It's able to work on larger areas of muscle movement. So I like it a lot for around the crow's feet when we have a lot of movement there. But yeah, it's a really great product, and also is yeah, I mean, it can kick in a little bit quicker as well. So within like 2 to 3 days, some patients do start to notice that that movement is starting to go away after Dysport.
And does it last about the same then too?
Typically, yeah, for with Dysport and Botox, they last around 3 to 4 months. But again, I have had patients where it could last a little bit longer when if they get lucky. Also, neuromodulators can last a good amount of time if we're doing the proper dosage. That's why dose equals duration. We want to make sure that we're dosing the proper amount for you, so you do get that long-standing duration.
All right, next is Daxxify.
Yeah, so Daxxify is the newest on the market. It is a great treatment infused with peptides. So Daxxify was stripped of human serum albumin and the accessory proteins, some of them. And so it's kind of known as more so the vegan neuromodulator, which some people may like to lean towards that. It also, because of the infusion of peptides, patients have reported that their skin has had a glow to it after Daxxify. So it helps to revitalize the skin as well. So yeah, it's a really great one. And this one kicks in very quick as well. This one patients have seen after one day noticing a difference. So
that's amazing.
yeah.
Yeah, and I've tried them all, and I'm sure you have too. It's very specific to each patient too on like what is going to work well with you. So some people, are very true to Botox, and then they want to try something else. So if there's ever one that's maybe not lasting as long for you, or you just want to try it, I definitely encourage everybody to try all of them to see which one like works well with you.
Yeah, definitely. I like trying I like going back and forth between all of them because it's a very low amount, but I just don't want to build any tolerance to one or the other. So I do like trying all of them, kind of seeing what works for you, what sets in quickest, and yeah.
Amazing. So here are some before and afters. Obviously we talked about that skin quality. You can see immediately. I love this before and after. What a great result. What do you see?
Yeah, I mean, that's amazing. So yeah, treatment onto the forehead, it's gonna help those lines when we're raising our eyebrows up. It also can help to provide a little bit of a brow lift as well when placed strategically. So can help to open up the face, lift the eyes, and yeah, just provide a really smooth forehead, great results.
Yeah, I feel like you can definitely see that.
Yeah, yeah, our eyes look a little more lifted too. That's yeah, great.
Great. Another one. Love seeing males getting treatments as well. I see you get skin quality.
Yeah.
Else?
Yeah, we have a good amount of male clients, and I feel like sometimes men are more like apprehensive about getting it done. But when we have them come in, they love it and coming back time after time. Like I was even saying, my father, he was apprehensive about getting it done, and now like every 3 months, he's like, I need to be frozen. So yeah, really great results there.
All right, another one. I see super strong. That 11 line. She doesn't really have an 11 line, huh? She just has a 1.
Yeah, it's more one. So yeah, all of our muscles are different than each other. So some people have the 11, some people have the 1, other people have more of like a horizontal line we see sometimes. So yeah, but that's great results. She hardly has any movement after that treatment.
And Catherine wrote a great question, just wondering, does the treatment limit facial expression?
So with Botox, it's going to limit and help to relax the areas of that dynamic movement where we do not really want it as much. So say on the forehead or in between the brows, it's going to help to relax that movement. It's going to still look very natural. And especially, with Revive, all of the providers are amazing, and it really depends on the consultation and going through exactly how many units you need. Everyone's different. It's kind of like a prescription, but where you're prescribing a certain dose for one person, it's going to be different for another. So your provider is going to go over that with you, make sure we're giving you the perfect amount to ensure that you're getting great results that still look natural. They're not going to limit your movement in areas where we don't want it to be limited. And we're going to ensure that it's placed properly so that you just look nice and refreshed and relaxed with still amazing and unlimited facial expression.
Yeah. Maybe your angry face won't be as strong,
yeah, which is not
exactly. It's not necessarily a bad thing. And I do think most that don't like, if they've gotten tox before and they don't like it, typically we're probably overdosed because you're not used to having, as much less expression. So as Heather said, it's really important to go to, an experienced provider that understands your muscle movement. And then sometimes it can take a couple visits to get it right and get your proper dosing for everything. So it's best to do less in the beginning, and you can always come back in and do more too.
Yes. Yeah. At Revive with our patients, we like to see you back in 2 weeks. So like I said, it typically takes about 14 days to get those full results. And then we'll kind of look at everything, make sure you're happy with treatment. If we end up wanting to add a little more, we can. But yeah, so we're really diligent about following up with our patients and making sure we're providing the best care and treatment for you.
Absolutely. Good question, Catherine. And Annette mentioned how she got compliments on her skin after her Daxxify.
Oh yeah.
Yep.
Yes. Gives that nice glow because of the peptides.
And then this is an example of a lip flip. Very nice.
Yeah, that's amazing. So yeah, our upper lip, it can curl under a little bit. So when we inject a little Botox right onto the upper lip, it can provide that little extra bit of volume and a nice lift. So it's a good alternative if you're maybe not ready to get filler, to do a lip flip, because it'll give you a little extra volume on your upper lip.
Looks very nice. All right, perfect. We're gonna start preparing for the live demonstration. Actually, I'm not doing anything. Heather's doing everything. But if you guys have questions and you want to start putting those in the chat, that'd be great. I think I have a question too for Heather while she's preparing. I'll turn everything over here.
Yeah.
If a patient like, say they're a first timer and they are just more concerned with their 11 lines, say, in her forehead, what would typically be like the dosing for that? Like how many units should they kind of prepare for?
Yeah, so again, it does depend on their movement. Some people have more limited movement than others. Typically, we're going to see anywhere from about like 12 to 20 units to start for that specific area. That complex uses a few muscles to, that are creating those lines. So it does require a little bit of a higher amount of Botox just for that specific area. But FDA approved, highest we go is about 20 for the first treatment.
Okay. So, yeah. That doesn't seem too bad.
No, not too bad. And I mean, as long as we're getting the proper dosage, it's going to last about 4 months or so. And it's great. Anything to help prevent those, static.
That's not too many units either. What should I avoid doing to my skin after treatment to get results to last as long as possible? Yeah,
so for after treatment, we do have it. It's our model here.
Our model's coming in here.
We have aftercare that we give to our patients. Hi.
Hello. We have our audience here if you want to say hello.
Oh, I see.
So this is his first time getting any sort of neuromodulator treatment. So we're really excited. Are you excited?
Definitely.
Yes. Nice and frozen. So sorry, what did you ask? What should patients avoid for after treatment or for their skin? So yeah, typically after treatment, we suggest no, for topically on the skin, I usually tell my patients not to put makeup, any sort of skincare on for the rest of the day.
Mhm.
We are making little tiny micro punctures with our needles, so like to keep the area nice and clean, ensure that there's no irritation to the area. As well, for the rest of the day, I tell my patients not to lay flat for around 4 to 6 hours. That's just due to placement of the medication. I want to make sure that it stays where it was placed and we don't have any sort of movement there. Avoid facials, any sort of massages, hard pressure onto the skin for the next 2 weeks until you come back in. And I also suggest no exercise for the rest of the day. So we definitely don't want you like heating up your skin or doing anything that's going to cause sweating. Avoid hot showers, saunas, jacuzzis, and yeah, just keep it nice and easy for the rest of the day. Other than that, avoid blood thinners as well after getting any sort of injection or really any treatment.
I was gonna say, what about, so blood thinners, what about those that like to have their daily glass of wine? Is that like a no-go? Is that something
I
you
mean,
think about before and after?
So when we inject with the needle, there's always risk of a little bit of bruising with Botox. The needle's so tiny, it's very minimal, if not anything. But we do suggest to avoid alcohol, caffeine, any sort of like pain reliever, blood thinner, because it can lead to more thinning of the blood, which will make your bruise a little bit more significant or worse, and swelling. So, but yeah, if you have wine, I won't tell anyone.
And it won't do anything to the actual treatment itself, right? It's just more of like potential.
No, it's just for, to ensure that we can avoid any sort of potential bruising or swelling, but it won't affect the treatment, so.
And then to also to bounce on Rebecca's question is for results to last longer. I mean, I would recommend, right, skincare, and we do have some specific skincare that's supposed to help prolong.
Yeah, so like as I said, when we reach our 20s, we start losing our collagen. So that's going to lead to our muscle not being basically as attached onto our skin, and we're going to see more movement there. I suggest doing great skincare regimen, things that are going to help to build up our skin, stimulate collagen, tighten, thicken the skin, because it's going to work in conjunction with the neuromodulator treatment. So like retinol is a really great treatment. We have a bunch of great PTOX. We have all medical grade skincare here. So it's all been tested to show that it actually does improve the skin quality. So it's great. And then laser treatments, different sort of treatments that help to strengthen our skin, stimulate collagen, and yeah, it's all gonna help our Botox to last longer and give ourselves, more of a glow to the skin. So yeah, I suggest doing multiple modalities and not just sticking with one.
Perfect.
Yeah.
So as you're drawing up right now, and then we'll have Heather do her assessment too, so you guys can hear what consultations will look like with a patient.
Yeah. And I already did what we call a good faith exam with our patient. So just went over his medical history with it, ensuring that there are no contraindications for treatment. And he is good, all cleared and good to go. So do you have any questions about the treatment? So we kind of briefed you a little.
Yep.
Yes.
Yep.
Yes. One of our registered nurses is his daughter, so she was able to prep you on all that as well. But we'll kind of go over everything. And then I know you haven't had Botox before. Do you know anything about the treatment? Or
I don't actually.
okay.
Yeah.
So yeah, it's a medication. It's going to help your muscle to relax by telling your muscle and nerve basically to not have that communication that makes it have the movement. So it's going to help to relax your muscle from having movement. It'll kick in anywhere from, I'd say, like day 3, and then day 10 is where you're going to notice you're seeing that movement starting to subside. And by day 14, which will be in 2 weeks, is when you'll have your full results. We could have you come back in and we'll just look at everything, make sure it looks good. If we need to do a little touch up, we can at that point.
Okay.
But yeah, then it will last for about 3 to 4 months.
Awesome.
And if you exercise a lot?
I do.
Okay. So yeah, with exercise, sometimes we notice it's closer to like the 3-month mark or so, but yeah, about like 3 treatments or so a year is recommended.
Okay.
And it kind of is like muscle training. If you come in every 3 to 4 months, it's going to help to teach your muscle to be more relaxed. So
Very good.
Are you excited?
Started in
I'm
second.
excited.
So,
Definitely.
It's a fun time where needles are fun. Huh?
I know, right? It'll be tough.
Yeah, they're tiny needles. So these are same needles that patients will use, like diabetic needles, correct?
Yeah.
Okay.
Yes, they're little insulin needles. They're 31 gauge. If anyone is familiar with like needle gauges, so very safe and pretty painless, honestly, and it's worth it. The little pinches are worth it. Okay, and then we also will get some photos of the patient typically, but we did that before, just so we're able to see the befores and afters. But let's see, can I grab a little mirror here? And then, so in terms of areas that you're interested in treating, what bothers you, or what were you kind of thinking about when you were interested in getting a neuromodulator? What areas really?
I mean, definitely around my eyes.
Okay.
And yeah, this,
And we'll have to put up here a little.
yeah. So I've got
And then
my
relax.
forehead.
Okay. And you can see you have very faint lines that are more what we call the static lines, so they're at rest. So when adding the Botox, this is gonna help to smooth those out as well.
Okay.
And then we can mad face. Okay, so you can see you have the 11 lines that we call them. So with this, we'll inject into the muscle here and then a few points on either side, because we do have multiple muscles all throughout there. And then usually people do like the top 3. So about around, if you can smile, just good breathing. So yeah, we can go around here if you like, just to help relax that a bit. Okay.
Okay. Sounds good.
And then let's see here. So typically the upper third, so forehead, glabella, crow's feet are standard areas that a lot of people like to treat when they're first coming in for treatment. Today we can do a little bit more if you would like. Let's see here. Are you able to go like out your? Okay. So we have a muscle right here called the mentalis muscle. It pulls in on our chin, causing what we call an orange peel kind of look. So we can inject a little Botox there to help smooth that out. And then go like E. I like say E. Oh yeah, here's the faint, but we could do a Nefertiti lift and into the platysmal. So that's going to help to sharpen the jawline here. We have muscles that hook into our jaw there and kind of pull down. So when injecting, it does the opposite and it pulls up or helps to kind of sharpen that area. Sound good? Something you'd be
Sounds good.
interested in?
Definitely.
Okay.
Yes.
Perfect. I'm going to clean you up really quick and we'll
Okay.
work you as well.
Okay.
Need some more questions have popped up. So, Leslie says, I have done Botox 3 times now, and I've noticed this last time my results aren't lasting as long. Am I building up a tolerance, or do I need to try another tox?
Okay, so with the tolerance question, we have seen patients that say it's not lasting as long as it used to. It could be, for one, as we get older, muscles do start to have stronger movement. We are losing collagen each year, so that's another point where I'd say definitely keep up with skincare, good laser treatments, things that are going to help to improve our skin quality and strength. As well as I like to switch off between neuromodulators just so I don't build any sort of tolerance. There have been studies, but it's a very, very low amount of people that actually do build any sort of tolerance to a medication. So not something to be too worried about, but definitely something to think about. So maybe switching from Botox and then the next appointment doing Daxxify. And kind of, you can also see what works for you as well by doing that. And then also I tell my patients to take zinc supplements. There's been some studies that have shown that zinc does help to increase the length of time that it lasts. And then lastly, like I always say, the dosage equals duration. So we always have to make sure we're getting proper dosing. We're giving you enough for your muscles and, giving you the best results that you can and, the proper treatment so that it can last as long as we want. So yeah. You need one of those speed ball or anything?
Maybe I do.
Yeah, but it kind of hurts. It helps to distract.
Okay.
So now I'll go over with the patient. We'll kind of have him make movements so we're able to see where the muscle's moving, how many units we're going to require for each area on the face that we're treating. So we'll start with the forehead. And sometimes I'll have my patients look in the mirror when they're making the movement because I don't know why, if you're not looking at yourself, sometimes it's hard to make the movements as strong as usual. Raise up super high. Okay, so we can see a lot of the lines going straight across here. So I'll just mark off. And then look towards me really quickly, or turn this way. Okay, and then make a mad face, really angry. And then I'm gonna have you smile or squint really hard, like there's something in your eye. And doing treatment around the eye is really nice because it really helps to open up this area. We even sometimes do a little lift on the corner edge of the brow. It helps to give a nice brow lift. So I love doing around the eyes. I think it makes a big difference. It's been really hard again. And then go like, perfect. I don't know if you guys can see his platysmal is popping out a little bit, but we'll inject right into that band there. It's gonna help to relax it. It's hooking up onto your jaw right here, so it's gonna help to push that up. And then I also go a little here, and we'll go right along the jawline, called an Nefertiti lift. Again, perfect. Go in the front too. All right. And then just pout your lower lip out. So you can see how this pulls in. We'll do a little there as well. Okay. And so when injecting the forehead, we never want to go too low because don't want to make him feel heavy. So I'll stay, on the upper half of the forehead. Now he does have strong movement. So if we raise up really high, if we notice he's still having some movement here in the next 2 weeks, he can come back in. We'll just add a little tiny unit there just to help relax that. And he's a first-time patient. So as you continue to come in, we'll kind of know your perfect amount that you need and what works for you. But for the first time, we do like to see you come in just so we can go over everything.
Okay.
All right. Gonna start on the forehead. Ready? Little poke here.
So Andrea says do his DAOs.
Oh, yeah.
Requesting, yeah. And then Ellie asked, or
Are you
I'll ask
okay?
a good
Mhm.
question regarding preventative talks. I know we kind of discussed that and covered a little bit of it. But yeah, is there any age to start too early?
So you can start at 18 if you'd like. Like I said, when I went and got Botox, I remember the nurse was like, you don't really have too much movement, but we'll give you like 4 units just so you can get something. But I would say the best time to start is when we start to notice that dynamic movement. So when you start to notice when you're lifting up, you're seeing some little lines, that would be a good time to start. like I said, we start to lose our collagen around our early 20s. Some studies say as early as 21. So if we're starting to notice that movement, then it'd be a great time to start. I always say it's easier to prevent than it is to have to reverse. So are you okay? And now if you kind of turn and just look towards me this way.
How are you feeling?
Oh, fine.
Raise up really high again and then relax. Yeah, you're doing great. Raise up really high and then relax. So I just did 16 units across his forehead for today. You could go up to 20 or so there. But I'll have him come back in for a touch-up, so we'll make sure we get it nice and perfect. I don't want to do too much on his first appointment. Make a mad face, really angry, and then relax. Right into the center here. Mad face again, and relax. And then a mad face again, and relax. A little sensitive here.
So with making the expression to like during injection, because I've been injected too both ways or no expression and then doing it. Is there a better way? Does it just matter just depend on the injector?
It can depend on the injector because we all do like our different little things. I kind of just like to do it to be able to see that muscle right where it's moving before injecting, as well as right here on the corrugator. I like to make sure that I'm injecting, medial enough to where it's a safe injection. If you make a mad face or mad, you can see right, it makes like a little arrow. So we know not to go behind the arrow, we go in front. So I like to see that movement for safety and just to see that muscle as well. Make a mad face and then relax. Mad face again and relax. Mad face one more time. Go into this side really quick.
You're doing great.
Oh, yes.
Yeah, you're a pro. Mad face again and relax. A little sensitive on this one.
So Sherry was asking about bruising, and I know we kind of briefly discussed it, but will there be any bruising after Daxxify specifically?
So with any time we are using needles or devices that are causing puncture within the skin, there is always risk of bruising. So I typically tell patients to avoid anything that's going to lead to thinning of the blood. When we have thinner blood, you are at a greater risk of getting a bruise. So avoid, for the day before and day of treatment, any sort of pain reliever like an Advil. Try to avoid fish oils, vitamin E, different supplements that lead to thinning of the blood. Try to avoid like your morning coffee, alcohol the night before, just to prep your body, and try to have a little bit of extra help in prevention of bruising. But even if there is a tiny little bruise, it's so minimal. It goes away so quickly, and it's worth it. Because the results speak for themselves. I never mind if I get a little tiny one, but usually it's very minimal.
And there's no way to prevent 100% to not get a bruise.
Yeah, not really unless we were like doing ultrasound guided. But even then there's risk of, nicking a little vessel. We have so many vessels within just our face alone, veins, arteries. So it is sometimes inevitable for some people that you'll get just a little tiny bruise, but not to worry, it goes away very quickly. And we have different sort of skincare here that does help with healing of the skin as well. A supplement called Arnica in it, which Arnica helps to heal the skin as well as heal bruises a little bit quickly. I already did the upper one.
Can you take that also as like an oral supplement prior to
Mhm.
coming and getting any injections?
Yeah, you can. So yeah, arnica, it can be found, I'm pretty sure like even at like CVS,
Mhm.
Target. We use the brand Arnicare usually, but yeah, it comes in a little sublingual tablet, and patients use it for like even after surgery to help with healing. So just doing a little blebs right under his eye here. Smile really big again and relax. Are you doing okay?
Oh, yeah.
So, Annette is asking about doing talks for a flip lip with parental consent if you're under the age of 18.
So we don't offer that with Revive. So unfortunately, yeah, we do require you to be above the age of 18 for any sort of neuromodulator injectable treatment. But I remember I was calling my sponsor when I was like 17 asking for I could get filler, and they're like, no, you have to wait. So I'm going to have you out your bottom lip, and then we're gonna go right there and there, little pokes. You can relax if you like. Sometimes the chin can be a little sensitive. You okay?
And then Michelle is asking about how many units he's receiving today, but I think we have to wait till the end and count them all up, right?
I drew up 90 units.
90?
So,
Oh, no, okay.
but
There you
we
go.
may do more depending. So yeah, a good amount. But honestly, with full face neurotoxin, people will do 100 units or more. I mean, some muscles require just alone like 25 to 30 per side, such as like our masseter muscle. So with full treatments, from top to bottom, sometimes you can be seeing,
Mhm.
over 100. All right, and then we're gonna do DAO. Please, someone, will you make a sad face? So really proud of. So we have a muscle, the depressor anguli oris, which kind of can pull down the corner of your mouth there. What we can do is inject pretty superficially into it. It's going to help to relax the muscle that's pulling down and help to slightly upturn his smile. It can help with people that maybe are experiencing some marionettes too, just to help relax that area. So when you inject that one, always do pretty superficial, and I inject where the medication will be going outward. Make us face. I'm gonna clean you really quick. Actually.
All right. Yes, are you using the same talks? Are you using the same talks all over his face?
Yes.
Okay.
So we are using Botox today. Typically, I like to stick with, the same talks for the treatment. So we like to keep it uniform for all of the areas. However, next time when you come in, you might want to try Daxxify or Dysport, because we have both of those and kind of see which one works best for you. Okay. Okay. And then look towards me, make a sad face again. Okay, and then relax. Perfect. All right. Well, so
Another great question is the
you're doing
product.
great. I know it's a lot of
Oh, no, it's all good. Yeah.
Catherine asked, is the product mixed already and constituted as it arrives, or do we have to constitute?
Yeah, so the product does not come constituted, so we reconstitute it in office with the FDA approved recommended amount. So all of our providers do that for our patients, and then we can store the medication, but yeah, it doesn't come mixed already. We mix it here.
Well, because when you mix it, has a clock on it after that, correct?
Yeah. And this is probably one of our most popular treatments, neurotoxins, just because of the effectiveness, how quick it works. So we go through, if we open a vial that morning, it'll be gone by the end of the day usually. So because we don't like storing it for too long, we never do though, because it goes through so quickly.
Sherry asks, Dysport and Daxxify, which one lasts longer and is more effective?
Again, every neurotoxin, it kind of works just on how your body processes it. So for one person, Dysport may last a lot longer. For another person, Daxxify might be great for them. I always like to look at muscle movement too. So like maybe if you have a stronger muscle movement, Dysport would be better for getting like smile really big. So Dysport will help to spread more, where Daxxify is really great and specific for different areas. But yeah, I think it's great to just try different ones and see what works best for you. Go like here, little poke. Like Eden. Here. Are you okay?
Yep.
The neck ones usually don't hurt too
Yeah,
much.
don't really feel them. Yeah.
So,
Yeah.
Carrie asked a great question. Is there a limit to how much you can get in a day?
I think it's 400 units or so. Well, because in actual medical treatments, treating for like interstitial cystitis or like muscle dystonia, you can use a good amount with those. So, but typically in treatment, I mean, for full face, and then even if we're doing like the neck, people could do like hyperhidrosis. You can be getting, well over 100. So,
and someone had asked earlier in the chat about regarding if we do it in other areas of the body, like the traps.
Sorry, I thought you were asking more.
If Revive does do like the shoulders.
Yes, yeah, we do. So that was when the Barbie movie was out, they were calling it like Barbie Talks, because it gave like the really nice like swift shoulders there. So yeah, we do trap talks if you do have stronger trapezius muscle. I usually just won't do it if you're someone that is like a trainer, works out a lot, because it will weaken that muscle. So
I guess which movement would it weaken too for
so it more so the trapezius, it more so just weakens this muscle here where we're lifting our shoulders. So it helps to relax this big muscle here, and by relaxing it, it gets smaller, and so it kind of makes like a nice little like U swoop shape there. So it's and then relax.
How many units typically would someone need for a big muscle like that?
Ooh, like 50% or something.
Yeah,
or like
per
25 to 50%. Yeah. Okay.
All right.
Oh,
Lourdes asked your name. This is Miss Heather. She's our
Heather.
NP here in Laguna Niguel.
Yes.
And then, perfect. Revive already responded. Okay. Yes, Janet, if you hold tight, we're going to have all of our promotions here at the end and our special offers specifically for all the attendees today.
Yes. And we're just about to be done.
And then Lourdes also did ask about does injections in the jawline help with saggy jowls?
It can, yeah. So yeah, when we have a weaker jawline, it can lead to jowling right here. So yeah, by helping to lift and tighten, it can help with the jowls, as well as doing just lower face talks in general, like what we did today with this mentalis muscle, and then with the DAOs. Anytime we're helping to kind of lift, it's gonna help to mask those effects. With gelling as well, I think we have a lot of great laser treatments too to help stimulate collagen and rejuvenate the skin and help to lift as well. So like I said, multiple modalities to help to make a good difference with things like that. And then go like you're doing really good. Okay, that was 100 units. Nice. First time just going for it.
No big deal.
Yeah, it wasn't bad.
No.
And then yeah, with him we noticed like a little bit of pinpoint bleeding, but nothing really where we had to put pressure. So risk of bruising for you, very minimal, and that was 100 units.
Okay.
I'll put on a little bit of our arnica here, and that's also going to help with prevention of, any sort of bruising or swelling. And yeah, so that's what we were talking about, the arnica hair.
Okay.
Yeah. Any questions
Wonderful.
for me? As far as, I don't know if you heard the aftercare at the beginning, but
I did hear.
yeah,
Yes.
so just
Mhm.
no pressure on the area, no laying flat for the next few hours, avoid exercise today. And yeah, blood thinners, avoid those as well. We're gonna send you all the aftercare instructions to your email too.
Awesome.
So
Awesome.
yeah,
Thank
all right,
you.
well, thank you so
Thank
much.
you. Thank you.
Great job. You're a good sport.
Oh, thank you.
Yeah, you're great.
And for a lot of you, I know if you're interested in doing, a big treatment like Heather just did, and that's part of her specialty as well, is doing a full facial assessment. We do offer like banks too, so you don't have to do per unit. You can buy a bank, and even if you don't use the full 100 bank, you can use that for future treatments, and that can help a lot with cost as far as per unit. If you're a Radiance member, that's how you get additional promotions too. And if you don't follow us on all of our social media platforms, here they are right here on our Instagram, TikTok, Yelp, and our YouTube. We do have, as Heather was mentioning previously, is we have a lot of multimodality treatments, and that's kind of what we specialize here at Revive as well. So you can go onto our YouTube channel and get more information and another educational webinar regarding a lot of those multimodalities. I definitely recommend doing that because there's so many treatments out there. It's hard to know where to start, what to do, what you're a candidate for. So it's great to get educated as well as come in for a complimentary consultation with one of our aesthetic specialists or one of our amazing providers. Amazing. Thank you, everybody. Let me see if there's any additional questions. Do you take volunteers to be demonstration patients for our webinars? Catherine, if you're one of our Radiance members, it's probably the best way to go because we have additional emails that go out. But yeah, it's something you could also message in our social media platforms to see if we're looking for any models. Thanks, Annette. We're good luck in your 1 year. You're almost there, girl. And then Andrea, I hope he shares his results. Yes, we should definitely make sure we get the 2 week, and yeah, amazing.